We had a mink go through our front yard today.
Really?
Isn't that weird?
Animals are starting to travel a little bit here. I heard bears are out.
Yeah.
There's Dale. Good to see you, Dale. Rachel, do we have you yet? I know you were having trouble last time.
Yes,
Okay.
I am here. Thank you.
Thanks, Rachel. Ursula, can you hear us?
Yes. Can you hear me, guys?
Yep, we can hear you. Can't see you.
Awesome.
Hey, Terry, you made it on time.
Shocking, I know. Every once in a while it happens.
Well, you said you were going to be a little late, but.
I thought I was, but unfortunately it actually turned out, so.
Good, good. We'll give it a couple more minutes. We're only a couple.
Happens.
Hey everyone,
Yeah,
this
we
is
are
Laura.
live streaming on YouTube right now, just so you know. It's live on the city website and on YouTube.
Hey, Laura, how you doing?
I'm doing good. Mary Jane can't make the meeting today, but I'm going to be here joining you guys.
Hey, Greg. How are you? Looks like we got a pretty good turnout again. That's great. Well, let's go ahead and get started. Thanks everybody for being at this second meeting. Over the weekend, I think we saw a few more people up in the community, and we did get some comments back that we'll talk about when we look at a little round table and some more input. And John's going to take.
Good job.
A couple of things that I've been doing and keeping up with. One, I've been continuing to research other communities and how they're trying to prepare something to either do a variance or to be able to roll their community out once the governor gives a thumbs up. So that's also on a call this weekend with Joe Nagoose, and he has given us some very good information moving forward. One is some funding for municipalities. They already gave some funding to communities over 500,000, and now they're looking at how they will divvy up some money for communities under over 50,000 and then under 50,000, and they'll be doing it on a per capita basis. So with 1,700 population, I'm not so convinced that we'll get a whole lot of money, but right now anything will help, right? The other thing is that we've been keeping an eye on, and Congressman Nagoose has also been pushing for what's called CARES 2.0. And this has to do with a lot of those of us that have gotten the PPP, potentially being able to reallocate the way that we're using those funds and still not have to repay them. Another part of that is to potentially have another round of funds available to small business owners like ourselves and others in our community that we can potentially get some more funding to help us move things along. We're still waiting on that May 18th date where the governor is going to present to the state if and when and how we can start opening up restaurants and what capacity we can run on and what that might look like. So of course we want to be ahead and not behind that 8 ball. So we're prepared. So when we get word, if he tells us on the 18th that by the end of the week, we can start, opening up restaurants to a certain capacity, or how we could, we talked about setting out tables in the street and having places for people to take to-go orders and go sit. The city met again this morning and just kind of updated on the things like this that I heard over the weekend and that I was part of over the weekend. So that's kind of my update, and I'm really interested. Did everybody get the email with some of the comments that we had a few people give to us. Did everybody have a chance to look at that?
Yes.
Yep, I looked through that
No.
too.
Oh, I didn't know it was that, Laura. Hey, Laura. Good to see
Hi.
you. Okay, so what I'd like to do now is let's just kind of open it up for a public health update. Do we have anybody on? I don't think we have anybody on. George, is it anybody from the county? I know that Charlotte.
We'll be connecting in a minute. So
I'm sorry.
George will be connecting in a minute.
Oh, okay. I know that Charlotte Hanson has directed us. We had a couple of businesses in downtown want to put out some tables and some people table and eat, and she gave us a call, and it was a hard no. We're not ready for that, and can't make it happen. So we asked them to remove the tables, and they were very compliant and understanding. So until George gets on and maybe give us a public health update, why don't we just kind of open up the discussion? Does anybody have anything to say? Comment on what you saw this weekend, what you think the next couple of weeks is going to look like playing up to Memorial Day weekend. All right, floor's open.
I have a question for the rafting. Since we have a rafting person on, who makes the decision on if rafting is going to happen this year or not? Is it the commissioners, county-wise, or is it a state thing?
Well, I can answer that, Steve. What it's going to come down to is basically the county will have to make it from a public health standpoint and determine how they could roll this out and what guidelines they would have to be able to do that. I talked to John Rice a little bit this morning, and he's very interested and very concerned about getting this thing rolling. I made a comment that may not have, I think he misunderstood my comment about, the rafting season brings a lot of folks into our community, and how would that impact downtown when those same folks that get off the river want to come in and visit our restaurants and our gift shops and everything, and how that looks like and how the city can manage that when that happens. Do you have anything to add on to that, Dale?
No, I think in general, you're right. I think, just like every business in this room right now, we're looking for state guidelines, which would be hopefully adopted by the county, which then each municipality would also have an opportunity to weigh in, right? So as we go from top down, things can get more restrictive, but not less restrictive, right? So that would be the same order of operations in providing guidelines for us to be able to operate.
Okay, Jake, you got anything on that? All right, anybody else?
Remember that if there's,
internet connection.
All right,
Jake, you're muted on there.
Okay, I see. I was kind of thinking what Dale said, it's going to come from the governor first, and then it would be an add-on as far as any restrictions. Obviously, we don't know any specifics yet. We can guess that it's going to require some type of social distancing. Last week I heard people discussing, like, is it a masks to the table situation? Is it a 50% occupancy type thing? I guess we won't really know to develop a specific strategy until we kind of know those things. I guess from our standpoint, we would love to get open as soon as possible, but we want it to be as safe as possible. So we have concerns about being able to even provide masks or hand sanitizer. Something like that, although seems simple, has actually been very difficult to try to get our hands on that. I know that some of the people from last week were working on that. I guess I feel like, gosh, we don't really know. We can come up with ideas, discuss all this, and have some type of a strategy to deal with various situations. So I think that this is awesome. I really appreciate all the participation of everybody else, and want to, just thank. There's a lot of people in this town, in this community, that really care, and it's a beautiful thing. It makes me proud to be a part of the community and a part of the efforts and evolved in that direction. I know it's mostly questions, not a whole lot of answers.
Okay, we'll get to those in a second. Thanks, Greg, for your input. Appreciate it. Anybody else? Josh, were you downtown this weekend? What were you seeing?
We had a pretty good weekend. We had a fair amount of traffic. It seemed like there were some tourists in town, although the majority of my business is still local for takeout and curbside on the weekends, which is what we're open for. Yeah, I agree with Greg. We want to get open as soon as possible. We want to do it as safely as possible. And I think that as far as the social distancing is concerned, that closing Minor Street is the only idea that I can come up with that's going to work for my business, and I think for everybody else in downtown. So I'm excited to talk about that today.
All right.
Hey, Mike, from the perspective that I've got is if we look at the data and we look at some of the comments the mayor has made, I really fully expect that he's going to be positive on restaurants for Memorial Day unless something strange happens between now and then. But the data is clearly trending in the right direction, and he clearly has taken a position that it's important to get the economy going. So, barring a spike, I think that we need to be prepared that there will be some positive change from a business standpoint before Memorial Day.
And Congressman Magoo's also was very positive about that as well on Saturday. So that's good to hear. Anybody else?
Hey, Mike, it's Lindsay.
Hey, Lindsay.
So I was at the deli all day on Saturday, and I was actually, I'm surprised it seemed like there wasn't much traffic. In my opinion, there were very few cars around, but then I had to go down to Denver. I was down in Denver on Friday, and it was packed. There were so many cars, and crazy. So, I would think we could expect people to start venturing back up here, but I felt like it was pretty dead over the weekend.
Okay. Another person.
Hey, Mike, it's Rachel. How are you?
Good. Thank you. How are you?
Good, thanks. I had a couple things. One, I've been working with the Colorado Event Alliance, and they are putting forth a huge packet of outline potential procedures to help our industry get open. And I am hopeful that we will get some guidance in the next week or so after that is presented. But if not, and the government still intends to keep us classified with the likes of Coors Field and Pepsi Center, I would definitely need to work with the county on some type of exception. And I would not want to follow the state orders if they are not going to address our industry as an independent industry from the big football stadiums and so forth. Like I said, I'm hopeful that they will, but if not, I would definitely like to schedule some time to work on that with the county and city. Also, I had an idea for all businesses for solutions for sanitizer. I just put in a large order with an online company that does custom sanitizers. They're like 1 ounce little individual sanitizer tubes, and they end up costing about $1.60 per little container, but they have your logo on it. And I thought, so, stores, restaurants, if you are required to have sanitizer for everyone, but you can't get it, this company is providing it, shipping it within a couple weeks. And the restaurants could just add it to the bill and say to customers, hey, we're required to provide sanitizer. It will be your personal bottle at your table where you're dining, and $1.70 is added onto your bill for it. Something like that, all businesses could incorporate it in some way. but then we're not taking on the additional costs of the sanitizer. We're not having to worry about, is the sanitizer station sanitized? You know, everybody has their own little personal bottle.
Okay.
I can share that link if anybody's interested.
All right. Thanks, Rachel. One thing I want to tell you, Rachel, is we were on the call with the state on Friday, and we, Andy and I, posed the question to the panel, Dola and other representatives, about your type of industry, specifically smaller venues like yours. And we got a very positive reaction from the group. Andy, correct me if I'm wrong, it was Ben Henderson. Is that correct? And he has taken the lead on that. And they, I'm sure, have had many, many inquiries about how y'all can start doing your business as well. But we were very satisfied and excited about that they were working very diligently on that. And we were going to ask back on our next state meeting. So just to let you know, we heard something very positive. We made sure that we asked the question specifically for your business. Very positive reaction.
Thank you. Great. That's great to hear.
Mike, I got a question.
Yeah, go ahead.
So when polls came out, first he said he was hoping that restaurants would open by Memorial Day weekend. And then he said he was going to look at the numbers on the 22nd. Then they kind of walked that back for the mountains. So we kind of were like, we need to be ready to open Memorial Weekend. We plan on it anyways for to go. But as far as opening the restaurants themselves, did you hear something that was more detailed, that had more insight to how soon they want to do that? Because it was somewhat of a mixed message, you know, just from the news.
So I think that they've been waiting, and I know they've been waiting on the May 18th date for them to gather data. What they're trying to determine is how this virus is moving around. And of course, we've been very fortunate in Clear Creek County that we have not, and I'll knock on wood, that we haven't had a whole lot of the COVID-19 virus up here. Andy told me that he heard something that may have led to believe that on the 18th, that they may give us a date even sooner than Memorial Day weekend for us to start. You know, we still don't know percentages or how to conduct the business. But Andy, you want to weigh in on that for a minute?
There was an item, some news information that came out from the governor's office. I think it was reported on Saturday that he's still planning to do his evaluation or his update on the 18th, but that, of course, that's only a few days before Memorial Weekend anyhow, but that even at that point, he may open things up. And as we know, there's usually a lag with the public health orders. So I still think it's reasonable to expect that things are going to loosen up to some degree by Memorial Weekend. And I think if we keep planning on that and working towards that, that would make a lot of sense.
Excellent.
And not only would we like our businesses to be prepared for it, but also the city to be prepared for what we decide and what we plan out as our next move to be able to do this. Of course, they're not going to say, hey, just go back to business as usual. It's not gonna happen. I understand over in Mesa County, Grand Junction area, that they believe they did a variance that allowed them to go ahead and start that 30%. I don't know a whole lot of details about it. I had a daughter that lives out there that called me and told me that they're starting to do that. George, we skipped over the public health update. Do you have anything from the county that you could share with us? Are you there, George?
He's muted.
You're muted, George. All right, we'll wait on George a minute. Cassandra, I'm glad you're on. Some of the ideas, actually, Josh has got it all laid out for us. We don't have to do anything. He's done a great job of putting some things in some bullets that we've already been thinking about and we think could work. Is there some money in the county tourism to start very soon to do some advertising, you know, as Steve said, Love Idaho Springs campaign or something like that.
Hi, can you guys hear me?
Yes, we can.
Thanks for having me. The tourism side of things, we have a monetary freeze on our dollars, and we are waiting to see when the right time is to, you know, reignite the advertising budget. But yes, to answer your question, we have funds available. We have a smart technology-based campaign that we were working on for the spring and summer. So when the time's right, we'll be able to launch that, which was going to be geared towards Front Range residents. So that will be great for us. And we're also designing a new website. So we'll be able to, you know, use that in some digital marketing to also promote the businesses in the county. So the simplest answer is yes. As far as the new campaign you're talking about, it would have to be a discussion with the board, as again, you know, right now there's a freeze on all advertising dollars, as we don't want to invite anyone to the county with road closures and things underway. So it's a waiting game at this point, but we're happy to help.
All right, thanks, Cassandra. Let's see, is George on there yet? Still don't have George. Asta, we haven't heard from you. I'd like to hear from you on, since you have another type of business, just, you know, consider it a tavern or bar, if you will. And, you know, we didn't see any comments from you, but what would you like to see, and what would you like to see us press forward with your type of industry?
Yeah, so I agree. I love the idea of Minor Street being closed. I'm sorry, I'm the only one here and my kids are here, so I'm sorry if it's loud. They're just kind of running wild right now. But I think for me, I'm not obviously on Minor Street. So, and I've talked to Marcel about it too, and I think he would like Idaho Mall to be extended into that closure of Minor Street, if that's, you know, to just like Chip does, he has patios on that. My question as far as me is, I mean, our food sales are like 20% of our business. We're 80% liquor, beer. So I'm curious the logistics of how we can extend our liquor license out there to Idaho Mall, or if you guys, I know you mentioned possibly, you know, just having it closed, and we have, I don't know how the logistics will work, but having, you know, you can buy a beer at my place and walk around and shop, or buy a beer at West Sundown or Tommyknockers. And so I'm just curious, from my standpoint, if I have to be shut, you know, have 50% capacity, that's going to hurt us a lot, especially on the weekends. I mean, that's when we're the busiest. So in order to make it, you know, to make my money this summer, we would have to have the Idaho Mall access to, like everybody else. How is my liquor license going to be? Is that the city? Do I have to go through the state? Like, do you guys have protocol for that yet? I mean, how do we get that kind of process going so we're ready for it when we can open?
Yeah, Mike, I'd like to reinforce what Asta's saying. I mean, when we look at the appeal of like 6th Street in Austin and Bourbon Street, et cetera, on kind of a walking mall, it really has great appeal. And I think that, I mean, it sounds real positive.
So believe me, we've been talking in depth about this, and I've brainstormed a lot of ideas to our city clerk, from doing, you know, extending the property like Josh's or Greg's out to the middle of the street. All these would actually take modifications of premises. And that's going to take too long because it has to go through a public hearing and everything. However, there's another thing we're looking into, and I believe Diane called it an entertainment district, and how that would work. So we could say between 17th and, you know, and 15th, that we could have that as an entertainment district. But that's a long process also, and a committee has to be formed, and, you know, it's a lot of what ifs and ifs.
What about
a special permit, a special event permit?
I'm getting to that. Who was that?
That was me.
I'm getting there. So we can do special events permit. Now, special event permits, you can only do it for a 15-day in a year. Now, any nonprofit can apply for that special events permit, including the city. So what the city is actively doing already is we're applying for our own special events permit so we could have the first 15 days. And then what we're going to do is we're going to find the Chamber of Commerce. Can Cassandra's group do us, and can we cover through this summer continuously with nonprofits being able to do this? And I think we can. If we can get the Elks to do for 2 weeks, the city to do two, you see what I'm saying? We may be able to carry this through and cover the whole downtown as being a special event for the whole summer. But it can only be for a 15-day period in a year. So it's not like the city can do it 3 times. We can only do it once. So we're actively working on that. We're reaching out to the Chamber of Commerce. We're going to reach out to the Clear Creek County Tourism. We asked the Elks if they would do one for us. So that's kind of where we're at right now. And if you have any other ideas that I'm not thinking of nonprofits, let me know so we can get it on the list and ask them. We'll do all the paperwork. I believe we can waive the fee. And we could implement a plan like this and get it done through the end of, through the end of August. Maybe even
Mike, would that be possible to do they have to be consecutive? Can you do like Saturday, Sunday and spread the 15 days over 8 weekends, like all of July? I mean, if that's a problem getting it organized, can you break up the days?
I need to check with Diane, our city clerk, on that. That's a good question. Do we really need it Monday through Thursday? Maybe we only need it Friday, Saturday, and Sunday. So that makes sense. And that's where we're at now. Let's hear
Might be easier to organize too.
If we did it in different, just on the weekends, Greg? Or
Yeah, it might be, you'd have to have fewer nonprofits involved. Say you'd only need 2 at that point, and you could cover, more than July and August.
So you're saying the city could cover 3 days for 5 weeks. That's our 15 days in a calendar year. So
right.
Andy, you taking a note on that? Okay, thank you, Andy. And like I said, I think this would be much easier than everybody trying to get an encroachment agreement from the city, go through a modification of your premises to be able to serve alcohol out to the middle of the street. So we really feel that this special events is the best path to take.
Hey, Mike, would it still be considered an extension of premise if it was just community tables that were out there? They weren't dedicated to any particular restaurant and people could just grab their own table?
Well, we still have to get past the open container law. So the answer would be no. We would have to have a defined area on a plan that said this would be the area that alcohol could be consumed.
Hey, Mike, it's Lindsay. I was down on Tennyson Street yesterday, and they, the restaurants were selling alcohol in like a plastic cup with a straw, like you get a Coke, and people were, sitting out on benches, eating and having their drinks. So it might be, I'd be curious kind of what they're doing down there and how they're allowing it.
Where was that at, Lindsay?
Down in the Tennyson Street Business District.
Can I comment on that too? Just as far as, so we were open this Saturday and we did a whole bunch of food, and we did, my understanding with the liquor board is that you can do alcohol to go with a lid on it and like a tape over it and just say like, you can't consume this while driving, or this is to be consumed at home. So I don't know how it is down there, but I'm sure it's one of those things that they're just like, okay, you're off our property. Where you drink it, that might be the city that's just kind of turning a blind eye. Right. Because I don't know. If it's a beer, it's not like you're sitting there getting hammered in the middle of the day in the park. But go ahead.
Because we don't want to do anything like, did everybody hear about the shop/restaurant? They decided that they were just going to open up full blast down in Castle Rock this weekend, and they're in a lot of trouble. They're in a lot of trouble because they said that they had over 500 people in there. And when they showed the picture of inside their establishment, there was probably 60 people in a small place, and it didn't look well. I'd be surprised if they didn't lose their license, business license. Do I have any more comments from anybody? Ideas?
This is Dale. Actually, I'm super unfamiliar with the special event permits and whatnot you're speaking of, but my question is, who controls that 15-day time limit? And is there any way that that could be, changed given the circumstances and the national emergencies and local emergencies have all been declared?
Dale, I have not checked into that. That would be something John Kane's taking notes that we can check into. My take on that is they probably have one of these, I don't remember, a special entertainment district type license. And that's how they're operating, the open containers in a whole area. So, and the consecutive, yeah, I would have to check on that, Dale. I'm not sure how that would work. Anybody else? Okay, we're gonna hear from Terry from the medical side and kind of updating what she's thinking and what she's seeing.
Well, and I wanted to touch base with Laura too, because looking into trying to get masks, and I really like the idea of the individual hand sanitizers that Rachel was talking about. And if Tommy Knockers is doing the hand sanitizing, making big vats of hand sanitizer, that may solve that issue. I guess, the best recommendations that I suspect that they're going to be coming out with right now are masks, and they're really hard to come by right now unless you want to pay a premium, and then you can get them. But for instance, this mask that I have is my N95 that I take with me everywhere. And so this N95 mask normally costs 75 cents, but right now this mask costs $5, and that's through a group purchasing organization that I use through one of my memberships. But we wouldn't need to do something like this. We could do just like the simple surgical mask that has the ear loops, I think. And that's what I was seeing that was handed out at Costco and are much cheaper. They should be a couple of cents, really. They should not be expensive at all. But I haven't been able to find them in any sort of bulk, larger quantity that would be affordable. And I think Laura was going to be looking into that for the Argo. And I'm not sure, Laura, did you have any luck yet looking at masks, or maybe you haven't had a chance to do that yet? Oh, you're muted, dear.
I really haven't been able to find anything really cheaper than about $1 a piece. And that was, it was not an extensive search, but that was sort of what I came up with. I was, especially the question for me, of course, this is not hugely important, but we don't serve food or bev at the Argo. Would my employees be okay with just wearing like a bandana that they can, go home and wash every day or something like that? I mean, how strict are these guidelines?
I think it's going to come down to, what the governor says, but ultimately for the businesses, I would really encourage masks. And especially if people who are visiting the community do not have masks, we really want to have those available for them, either hand them to them for free or charge a nominal amount of money, because really no one can afford extra expenses at this point. So somehow when we're opening up, we want to make sure that we include with those advertisings, with those marketing materials, that everyone needs to bring their own mask. And I think most people are doing that wherever they go right now, at least I am. And that's what I'm seeing other people do. And, in the meantime, I will try to source some masks and see if any of my group purchasing organizations would be able to provide some. And I'll check with some other groups to see if we can get some more favorable costs on these masks. But I think that that's what they're going to be requiring. Is probably the masks, the hand sanitizers, the 6 feet social distancing, at least for groups. And I don't know about the 50% occupancy. Sometimes I see the 30% occupancy, but that really cuts into revenue a lot. So I think that those are probably going to be the top 4. I don't know how they're going to enforce a 10-mile restriction for rural communities or something like that. It doesn't seem very reasonable, but I think those other 4 recommendations are probably what I imagine that they will be going with.
I know the food vendors like Cisco, Shamrock, they may have, because I've expressed to them that I spent hours and hours, had ordered a couple hundred, waited 3 weeks, and then they canceled the orders. So even just sourcing them is just so difficult. I'm hoping that Cisco, Shamrock, US Foods will be able to supply at least, you know, a fair amount, but it's such an unknown. Like I've ordered it, had the order confirmed, and then canceled. That was both
For masks?
For
Greg?
masks, yeah, for masks, and
Yeah.
you know, some of the stuff's coming from China, but it is the simple, you know, surgical type mask. And I think that you, like you're saying, you have to have those at least. We've talked about pretty much having a requirement that no mask, no entrance, or source them so that you could be like 50 cents will be added to your bill situation. But people are going to resist that unless it's 50 cents. I mean, the minute you go to a buck, they may just walk away.
Right.
Yeah.
The other thing I wanted to mention is that we may want to reach out to our public health nurse, Crystal, because she does have a stockpile of PPE in a trailer, a blue trailer that I think is like Empire, a little bit west of here. And apparently there is a large supply. I don't know if we're saving that for something particular, but I think a pandemic would be a good opportunity to use those stockpiles. And so I can check back with her and see, and I don't know if the county would be in favor of letting us buy those, use those. I don't know, but I do know that I have been getting like 5 masks every couple of weeks from Crystal, and she has been helping me get a little bit that way. And I don't know if anyone is in touch with Crystal other than myself, but if you have any pull there, that might be helpful.
All right, thanks, Terry. Also, Chief Malenka does have where he's been ordering some on the internet. So why don't we'll ask him, and maybe the city, we can do it as a bulk order, and you know, get some of the businesses that would like to do a bulk purchase with us. They may have a limited amount that you can order. I'm not sure. I'll need to talk to the chief about that. So let us work on that as well. Let's see, who we not heard from. Go ahead, Steve.
I found a source that has these masks for 69 cents, and they sell them by the thousand. And they said if you want more than thousands of them, they have a container coming in a week or 2, so you can order 100,000 or something. I don't know if the price goes down. I have asked for more pricing at higher volumes, and I haven't got that yet. As far as hand sanitizer, we do have gallon jugs here. And then I did supply some unscented base hand sanitizer to another local spice shop. And she's looking at providing it in a smaller package with like a trademark aroma to it or something.
All right, that sounds great. Carla, you have anything to say?
Well, you might have seen my comments that came through. I apologize. They came through today, but I think it sounds to me like we're moving towards trying to open up some sort of outdoor space for Minor Street so that we can get the restaurants incorporated, and I guess retail as well. And the question, I guess, it sounds like it's important to have all of those pieces lined up, you know, whether they're, and it sounds like you guys are working on it, but I think if we put together a comprehensive list of everything that needs to check those boxes to make sure that the street can open up, or the 2 streets, Idaho Mall and Minor Street, can open up, so that that actually works for everybody. And then, you know, are there other businesses that need some sort of representation if you're funneling people into that area, would be my question. And are the locals still going to want to come down and shop and eat if hundreds of other people are coming up from the city sharing their germs? So those are kind of my concerns with that. I think on a separate but related issue, obviously, there's more businesses in town than just along Minor Street. And there's also more businesses than just restaurants. And so it's great to have Rachel and the rafting guys on and some of the retailers, because there's much greater, there's other businesses in town that we need to make sure that we're also encompassing into a real plan here.
Thanks, Carla. What the city's going to do is we've already talked about and going to actively go out and kind of measure off and come up with a drawing, a floor plan, if you will, of how we would lay out these tables. Another reason that we're doing that is the city is going to order some picnic benches tables to put out there. So I think there's probably going to be a week leeway of maybe a little bit more. So we'll be doing that tomorrow. John Kane and Andy and John Bordoni will be out there helping us. If any of you would like to join us, Randy, I know you're one that would join us, and everybody, if you want to be out there to come up with some ideas where we should block streets off, and then we'll have Chief Malanka. He's going to do the routing to make sure that traffic can get into our city parking lots and out of it without any complications. So we're planning on doing that tomorrow at some time. I would say probably around 10 or 11 o'clock if we don't have meetings, which most of us probably will be on a Zoom meeting. So,
Mike, I would like to join you. So if you can just let me know when that happens.
Okay. All right. Any other volunteers? Raise your hand. Asta. Okay. Josh.
What are we volunteering for?
Just to walk the areas around that downtown and kind of space out where we think these tables or these picnic tables could go, so the city can get an idea of how many we may need to be purchasing.
Yeah, it'd help too, for sure.
Okay, let's see. I'm going to look at my calendar for tomorrow.
Mike, anybody talked about the parking plan? Like, I understand we're going to block off a certain amount. Are we eliminating paid parking during this pandemic? Are we?
Somebody turn your picture off. I'm fixing to talk about you. And he knows who I'm talking about. This was, look at John smiling. This was suggested, but just to let everybody know, I said absolutely not. We would not implement paid parking right now. I just cannot see us doing that. We have asked the county if there's a potential for us to use their clinic site again for overflow parking. And maybe that would be, something that we direct our employees, hey, y'all need to park down there, guys. This is going to be, we're going to lose all of Minor Street. We don't know how many people are going to be here. So just for a short time, can we get y'all to park down there instead of parking behind us? So we've already talked about that too. I don't know if George can give us an update on that ask. George?
Yeah, as far as the use of the county parking lot, of the clinic construction site, I have not heard back from staff on that request yet. My understanding was that they had a meeting with the contractor that they've selected this morning. And so I anticipate having an answer back to you soon. Yes or no, I think everyone deserves a thorough explanation. And I don't know. I don't know enough about the construction schedule really to speculate.
Okay. So we have been looking at that idea as well. We know that we could turn in without parking spaces on Minor Street. We could run into a parking situation. Something else that y'all may have noticed is there is some construction going on. Chicago Creek Sanitation District is they had to run a line underneath I-70 or a sewer line to tie in over here. Their thought was to be able to do the construction through the parking lot and have it done before Memorial Day. They have been delayed on their schedule, and we have a hard no with CDOT that they will not from Memorial Day through the end of the summer, dig through that parking lot and take up that parking. John Bordoni, our Public Works Director, has said that when they do that, there's a good chance that there's not going to be a whole lot of parking in that whole area. So we need to get past the looky-loo tree watching season as well. So we're pushing them and standing strong on no construction through that parking lot until the fall. Another thing, real quick while we still have George, is there any update from the public health that you might be able to share with us and kind of what Charlotte and others are thinking?
The updates from public health are, we do have, I think last week I reported that we weren't sure if the state was going to handle contact tracing for us or if they were going to ask us to do it. It now seems to be clear that for a variance process to get across the finish line, we will have to show that we have local capability for contact tracing and that we won't go asking the state when we have an emergency. So, you know, the big hurdle for any variance to have any chance with the state is for an increase of that public health capacity. And I don't have much in the way of updates as to how that increase is going right now. It kind of stands where it was last week as far as the information I have. As far as what public health is thinking about the variance itself, the response that I've received has been that because we have to cross those thresholds associated with being able to test and do contact tracing before a variance could be considered, it would not be wise for us to ask public health to evaluate a variance request before doing the work of building that capacity. So I know, I mean, the county task force is going to be discussing today a potential goal around a variance to be submitted by May 18th. I don't think that that's realistic, and I'm not going to ask my staff to do that. That's not to say that a variance will never happen. And then the other thing that I have heard in asking around is that the Fremont County application, which does match a lot of our industries and structure, has kind of two things. One is that it's not complete, and the state has said that incomplete applications will be put to the bottom of the pile. So it would behoove us to submit a complete application. The other is that, and that's because Fremont County does not establish that they've met those criteria as far as contact tracing and testing capability. There are 17 applications across the state that are sitting there, many of which are incomplete, many of which are awaiting responses. And the priority is going to, just like in many regulatory environments, the priority is going to those who submit completed applications. So the other thing that I think is different between Clear Creek County and Fremont County is our proximity to the metro area, and I think the state's well aware of that, and the extent to which, therefore, we can find ways to think about how traffic moves in and out of various businesses in a way that's segregated from our local populations will be persuasive. Maybe that's the, I'm happy to answer questions.
Yeah, George, this is Rachel, I have a question. Is it possible to submit for a variance in phases, like a variance for one part of your community, but not all, because we have 100% capability to do contact tracing at our venue. We are actually putting an additional protocol in place for this season that once we're able to open, every couple will be required to submit their guest list with address and phone number for every guest on our property. So my question is, if we would need to go that route, is there precedent or provision in place where we could do it just for our business?
I think the short answer to the question of could we submit a variance for like this industry or that industry? I think the answer to that is yes, but that's kind of, I'm not exactly sure. I think we can say, you know, for example, I think many of the variances didn't cover every industry that exists in a given county. As to whether your ability to do contact tracing, I don't think that that is what the state is looking for. I think the state is looking to know that we can respond to a local outbreak. And so, yeah.
Hey, Terry, you just typed us something. Would you explain what you were talking about, please?
Okay, yeah. In regard to the contact tracing, it looks like this needs to be standardized. I don't know if people have to be certified for this per se, and maybe George can speak to that, but it sounds like there is a process, there is an education that has to be put in place for people to learn how to do this. Now, my understanding is that the county has a number of retired nurses that are perhaps available to be able to learn some of the contact tracing, but we have to have a standardized procedure. I don't know if that's statewide, countywide, nationwide. The CDC did have a procedure in place, but unfortunately they took those requirements down, and then I think they put up another one, but there's a lot of wiggle room. There's not a set protocol on how to do that exactly. So again, we are waiting on that, and maybe George can speak to the contact tracing procedure more. And I wanted to just remind everyone that I can do the testing within 24 hours of symptoms for anyone, locals, non-locals, anybody who is available, who needs testing. I just need the testing kits, and I can submit those to where the testing labs for the state. And then George, all this kind of comes back to you. If you know any plans for the stockpile of PPP that the county has in the blue trailer, Crystal had mentioned that there's a large amount of PPP available, and I just wanted to see if you had any information on that, or I can check back with Crystal.
Yeah, let's see here. So I don't know what I have heard, and I had heard this about a week and a half ago, maybe 2 weeks ago, is that the state was developing a training program. I don't know if there are certifications required or what that looks like, but I do know that, you know, we're not trying to put people through four-year college. And yes, I heard it publicly that 14 nurses, I don't know if they're all retired or currently working, but 14 nurses had indicated that they have that skill set and they're willing to volunteer. I don't know if that means that that's where the capacity and we just need some training lies. I do see that as a ray of hope. Let's see here, PPE stockpile. My understanding of the PPE that we ordered was that it was based on a evaluation of what we need for first responders and sorry, you guys, and then things like Mount Evans Hospice and the senior center in Mitchell White, and that's kind of the top priority for that stuff. It's all, you know, N95 or KN95 quality. So it's not the kind of PPE that we'd be looking to get distributed into the business community. I don't think we're asking the business community to be wearing surgical masks or N95s. I don't know if that's the intent of your question or not. And it looks like maybe I've confused you or said something that doesn't match with what somebing somebody else says.
Just to clarify, George, so I think that the stockpile that they have in that blue mobile unit is a variety of things. So I think there's some surgical masks, some N95 masks, but to clarify, does that have to be reserved for if we had an outbreak here and then saved for the most vulnerable populations? Is that what I'm hearing?
I don't think the intent at this time, given the amount that we have, is to distribute it to the general public. I think that it's, yeah.
Okay, we're going to try to start wrapping it up here. Is everybody okay with 10 o'clock in the morning? We'll meet at the around the coffee shop in Tommyknockers, and we'll have a piece of paper out, and I'm going to get a long tape from John Bordoni so we can measure cross width and kind of pace it out and measure it out how we think that it might be laid out. Real quick, Dan, do you have anything to, on the banking side and money side? Have anything for us? Are you on mute, Dan? Dan? Okay, we can't hear you. All right. Well, again, I appreciate everybody being on the call. Great turnout. Your commitment to this task force is far beyond what I could imagine. What I would like to do is maybe bring either Suzanne, is it Suzanne from the county, or somebody that's from the county public health side, see if they'll join our next meeting on Thursday. And some of these questions that George is not familiar with, we can maybe get a better understanding about that. So let's keep
there, Mike.
And thinking about how we should approach this and attack this, and we'll get a good plan in place.
Yeah, and
Hey there, Mike.
Yes, Rachel.
One last thing, if the city wants to borrow some of our banquet tables for an interim period, so they don't have to spend any money on them, we can certainly loan them. They're 5 foot in diameter.
Okay, how heavy are, that's the only thing that I'd be worried
Or
about.
circumference.
That if the wind comes down through there. I had that problem with my tables on my patio. A hard wind would come and those tables would lift right up. But we'll definitely check that out. Hey, Andy, Dan's asking you to unmute him so he can talk. All right, there you go, Dan.
There we go. Yeah, I was unmuted on my end, but I think it was the other end. The only comment on the banking side, and I was happy to hear you make your comment about Joe Neguse and CARES 2.0. The CARES Act, when it was passed, is nothing like the CARES Act that the Treasury Department instituted, and it's very frustrating for a lot of business owners that have gotten PPP loans moving forward, because the intent that was originally there, that Congress, Senate, and President passed, is not what currently is in place. So make your voice heard. Mike, if you have an opportunity to have Mr. Neguse give me a call, I'd love to chat with him about it. But there are efforts in addition to Congress. I know that the National Banking Association has sent a letter to the Treasury Department encouraging them to make some changes in this as well. So hopefully that'll happen down the road. And then obviously another frustrating thing that's happened is that the rules have changed a few times along the way, which has left some businesses short and made it difficult throughout the whole process. So that's my only comment. And I'm excited. I think that a smart solution on Minor Street specifically will help Idaho Springs. An opportunity to a restaurant or any business that only has 30% capacity is losing money. So something has to be done to help build that capacity. Once again, in a safe way. We said before, if we do it safe, continue to do it safe, then the word spreads that we're doing it safe, and then hopefully we can keep building on that. Thank you.
Hey, thanks, Dan, for that update. And when I can talk to Joe or George, if you would like to get Dan's number, if you talk to him before I do. And they were supposed to make a ruling either today or tomorrow. We may already get some information. All right, I want to tell you, we got to run to another meeting backed up with this. So thanks, everybody. We'll see the few of you out there at what do we say, 10 o'clock tomorrow morning, and looking forward to it. Thank you.
I'll be there.
Thanks, Mike.
Thank you, Mike. Goodbye, everybody. Thanks.
Thank you.